Hello, I'm Robert, fact checker and science blogger, and please be careful over Christmas. COVID-19, actually on Christmas Day, COVID-19 is likely to reach the grim milestone that 1 in 1,000 Americans have died so far of COVID-19. It's just a couple of thousand of deaths short of that, and probably tip over on Christmas Day itself. And it's the leading cause of death in the United States at the moment. So do please be careful. We can all celebrate when this is all over. And if you're meeting up for Christmas, then do physical distancing as far as you can. And or some of you I know quarantine for 14 days before meeting up, which is another way of being safe, that you're not going to bring it to other members of your family. And 14 days, 10 days, whatever it is, quarantine for a long time beforehand. And if any of you do get COVID-19, if you show the symptoms of possible COVID-19 on Christmas Day, then immediately isolate, because you probably have not passed it on to anyone else yet in the family. You should really isolate very carefully. This is the example that I showed you in the previous video. Like, this is how a young couple in Wuhan, and how the Li Ting, an emergency room nurse, looked after his wife at home after she got COVID-19. And he didn't. And he was looking after her. So if someone in your household gets COVID-19, strictly speaking, you should do your very best to completely isolate them. Give them a separate room and their own bathroom if you possibly can. Keep a physical distance from them. Look up the World Health Organization advice on how to look after someone who's got COVID-19. And don't just think, oh well, it's a mild thing and we all get it. Because it's, as I said, it's like Russian roulette. And if you're lucky, and you might be lucky, and most of your friends, you just happen to be, all your friends are a cluster of people who haven't got it bad. That's just luck. There'll be another group of people who just, maybe a few miles away from you, will be another group of people, and there's a cluster of them, and several of them have died. They're just kind of random. They don't know why. Some people get it very sick and some don't. Especially with sickness, apart from the very young is definitely protection. And your babies don't get it at all, or hardly notice it. And then the older you get, when you get to your teens, then you start getting a little bit more risk, and then when you get to your 20s, you're starting to get significant risk of getting really quite severely. And even young people can get it very bad if they're unlucky, and they get a kind of an autoimmune response kind of thing. But usually they don't. That's very rare in young people. But if you are at and it's kind of storm that builds up in your body, and it happens quite a bit later, that's very rare amongst young people. Only a few cases in a population. But amongst the over 20s, then you can certainly, there are plenty of stories of people who used to run up mountains, and now they've been maybe 3 or 4 months and they barely can make it down to the shop 100 yards away, and just spending most of their time just lying in bed. And you don't want that to happen if you're a young person. And then you can pass it on to the elderly, and then for them it could be really grim, and most of them will survive again. If you play Russian roulette, most people survive. And if you're lucky, you could have a half a dozen friends who all happen to have survived Russian roulette. It wouldn't mean it's safe to play Russian roulette. And it's like that. It doesn't mean that it's safe just because you happen to have some friends who have survived COVID. So please be careful. And your question is, do you want to spend one Christmas where you wear a mask and physically distance, or you from people you haven't seen for months, or do you want to play this Russian roulette with your life and with the other people that you're meeting up over Christmas? So do be careful and do distancing as much as you can, or the pre-meeting quarantine, or something like that. And then if you do get someone with COVID-19 with the symptoms, isolate. If you discover your contact, then immediately quarantine. And especially with contact as well, as soon as you discover your contact, if you then quarantine, then it's almost certain that the rest of your household is not going to get it from you, even if you develop the disease. It could be in you. After you've been in contact, the disease can be in you, and yet nothing happens for days or weeks. You would test negative if you were tested, because it's only in very small numbers. And if you can quarantine away from everyone else at that point, while it's only very small numbers in your body, then you can't infect them ever, because by the time you do develop it, if you do develop it, you're in quarantine. So this is the main way, and Dr. Mike Ryan of the WHO, he said that his golden wish would be if people were to quarantine and isolate properly. We would be able to bring this right down if people did that. And it would end, actually, if everyone did that. If everyone were to isolate when they had symptoms and were to quarantine when they had contact, and we could do our own contact tracing, if we were to tell people that you have been tested positive and anyone who's a contact, that means, and being a contact doesn't mean just walking past someone in the street. Being a contact means that you talk within 1 metre, indoors or out, for over 15 minutes. That would count as a contact. And the various other possibilities, or adding up to 15 minutes over a 24-hour period within 1 metre, then that would count as a contact. So the physical distancing makes a huge difference, because if you physical distance more than a metre, you're not a contact and your risk is very low. It's like looking both ways when you cross the street, if you do the proper physical distancing and make it totally automatic. If you are sometimes doing it and sometimes not, and sometimes thinking on the spot, well, I won't I, then eventually you'll get very tired of doing all that. If you just automatically always step back, and there's no need to stop and think about it, you become the step back person, the physically distant person. Except of course with your own bubble, and when you're not isolating or quarantining. If you do that, it's totally automatic, it's much easier for you, it's much easier for everyone else, they know what to expect. And all the things, you should learn how to wear a mask properly, and then make that automatic. You should learn how to wash your hands thoroughly, and make that automatic. And try and get out of the habit of touching your eyes, nose and mouth, and then that eventually can become automatic too. And then, but especially most important of all, the physical distancing, if you can make that automatic, except in cases where it's your bubble, or you have to do it for work or some reason, then wear masks if you can't physical distance for other reasons. And this then will protect you. Your risk will be greatly reduced if you do proper, really systematic physical distancing. Then your risk is about zero, really. It's not. There's no way of it to get to you. So that's what to do. Anyways, I hope you all have a Merry Christmas and do stay safe over Christmas.